Concussions. Brain impact against the skull are the most common type of traumatic brain injury. It is estimated that as many as 3.8 million concussions occur in the U.S. every year during competitive sports and recreational activities. A concussion is an injury to the brain that results in temporary loss of normal brain function. It usually is caused by a blow to the head. In many cases, there are no external signs of head trauma. Many people assume that concussions involve a loss of consciousness, but that is not true. In many cases, a person with a concussion never loses consciousness. Due to this misconception, many people are not properly diagnosed in a timely manner. In fact, as many as 50% of concussions go unreported. The goal for this program was to design a program that would help diagnose people who are unsure if they have a concussion. Based off their symptoms, we will output how severe their injury is and suggest what actions should be done to help the person. People with concussions often cannot remember what happened immediately before or after the injury and may act confused. A concussion can affect memory, judgment, reflexes, speech, balance, and muscle coordination. These are the symptoms we will be searching for in the program as the patient runs the code. Even though the most common brain injury, concussions are not usually diagnosed through brain imaging or scanning, the only way to evaluate if someone truly has a concussion is through their symptoms. Engineers are vital in the advancement of the medical field. Codes like this will surely be part of the future, especially in regards to the brain and brain health.
Our algorithm collects data from the user and uses that data to determine if the user is at risk of a concussion, how severe the concussion might be, and what steps the user can take for a proper recovery. In our code, the user is asked to input information using menus. Then, the code uses nested if statements to determine what condition the user is in based on their responses. Based on the symptoms that are reported and the questions about the injury, the code will determine if the user has a grade 1, grade 2, or grade 3 concussion, and what the user should do for their recovery. The code will also determine other aspects of their injury, such as if the user is at risk of second impact syndrome or how their recovery might be affected by pre-existing conditions. The code was set up with nested if statements because each response that the code could output is based on multiple conditions that are determined by the user's input.
Our code first starts off by asking the user to select their symptoms from a drop-down menu. And in this case, we have that the user, they selected they have a headache, they are feeling sensitive to light, and they're feeling mentally foggy. So from that, that is a total of 3 symptoms. And because there's 3, our program then asks the user to input their name, and they say that their name is Billy. And from there, it asks if the user is over the age of 12. And they say yes, they are over 12. So after that, the first question that is more concussion related is it asks them if they hit their head or not. And in this case, Billy said yes, Billy did hit his head. The next, they are asked another question, and that question is if they experienced a previous head injury within the last 4 months. In this case, Billy said no. So after that, the next question Billy is asked is did he lose consciousness? And he said that he did lose consciousness, yes. So from there, after that last question, because he said yes, our program then outputs like his diagnosis, if you will. We output that he has a grade 3 concussion and that he needs to seek medical attention immediately, and because he is at high risk for more injuries. We also included a website link that has more information about a grade 3 concussion, like what exactly it is and how long you can expect to recover and things like that. And because our code is asking just their symptoms, it's a lot of if statements, so it can go a lot of ways. So like, let's say if he said, did he hit his head? Let's say if he said no, then our program would be like, you are not necessarily at risk for a concussion, but if there are other symptoms that occur, we ask, or we urge you to seek medical attention. And like, let's say if he said yes for a previous head injury, our program would then say, hey, you are at risk for second impact syndrome, you need to seek medical attention. And if he said no for losing consciousness, he'll be asked another set of questions. He'll be asked another question asking how long does his symptoms last, And if it's less than 15, he would have a grade 1 concussion, but if it was more than 15 minutes, he would have a grade 2 concussion. So yeah, that's basically one example of our code if they happen to have 3 or more symptoms. But like say at the beginning, the user selects they have one symptom, and that's just a headache. We then ask the user like kind of basic questions, kind of like what year is it, basic math questions, and let's say in this case they get them all right. We then output you're not at risk for a concussion, but just to be safe, we don't be held liable for anything. We ask or we urge them if symptoms do occur to seek medical attention as necessary.
Limitations to our code. In regards to regular concussion diagnosis, other than checking symptoms, there's no other definitive way of diagnosing a concussion. Not even brain imaging is definitive. In addition to this, just being a code that the patient utilizes and not actually being able to check physical conditions such as pupil dilation or slurred speech is a huge limitation to our code. With all this in mind, concussions are generally tricky to diagnose in the first place. Signs may not appear for days or weeks after the injury. Some symptoms last for just seconds, others may linger. But through evaluating the symptoms, we can indicate the severity of the concussion in grades. Concussions are graded as mild, grade 1, moderate, grade 2, or severe, grade 3, depending on such factors as loss of consciousness, amnesia, and loss of equilibrium, all symptoms that